Hi, my name is Nu, and I'll be doing my disease report on herpes. So, firstly, what is herpes? Herpes is commonly known as a virus that causes sores or blisters around the infected areas, such as the mouth or the genitals. However, there are some recent cases that report herpes around the eyes, the fingers, and also the face. Herpes actually refers to a family of viruses known as herpes viridae, and it ranges from HHV1 to HHV8. Herpes is highly contagious when it is active, meaning when the blisters are present. It is very highly contagious. And also, herpes is chronic, meaning that once the body is infected with herpes, it will have herpes for the rest of its life. So the structure of herpes virus is very similar to a lot of other viruses. It possesses surface glycoproteins, which really help with the adhesion and attachment to host cells. It has that lipid bilayer envelope for ease of fusion into the cell. It has a layer called the tegument. It has a icosahexonucleocapsid, and it also is composed of double-stranded DNA. Okay, so going into the types of herpes, like I said before, herpes is a family and it ranges from 1 to 8. However, the most common ones associated to the name herpes is HSV1, which is the herpes simplex virus 1, responsible for the oral blisters, and HSV2, which is herpes simplex virus 2, and that's the one associated with the genital blisters and STDs. There's also HHV3, which is the varicella zoster virus associated with chickenpox. There's HHV4 and HHV5, which is commonly associated with the disease mono. There's HHV6 and HHV7, which causes rosola. And then there's HHV8, which causes Kaposi sarcoma, which is a tumor and that is commonly found in people with HIV/AIDS. Okay, so now that we know what herpes are, we're going to go to the modes of infection and how they infect the body. The modes of transmission include direct contact, such as sexual contact, and that's mainly how HSV2 spreads. And then there's also oral secretion, such as saliva and such, and that is generally how HSV1 is spread. Portals of entry as well as exit include the skin. Like I said before, transmission is through direct contact. The herpes are generally shown on the skin, and so during contact of skin, that's how the virus will enter and exit. And the incubation period, so the thing with the incubation period is this disease is chronic, meaning it does last in the body forever. So whenever it comes, it will basically stay in the body for life. Okay, so this slide right here basically just shows how the virus invades the cell. First, with the glycoproteins, it will help attach onto the cell, and then it will fuse with the bilipid envelope. It will go into the nucleus, attach onto the nucleus, and then deposit its DNA. And then, following up on picture number 4, basically the DNA will go through a series of transcription, and then picture number 5 basically just shows the assembly of the virus in the nucleus. After the virus is assembled, it will bud out of the nucleus, and then the last picture, it will bud out of the cell. Okay, so now that we've talked about basically the invasion of the virus, we're going to talk about now the effects of the virus. So some symptoms of the virus include mild to extreme genital blisters or cold sores, pain, itching, general illness, fatigue, difficulty urinating, and sometimes discharge from the vagina or the penis. Other effects include the increased risk of acquiring and actually transmitting HIV/AIDS. The most common symptom is the blisters, and that is generally what is used to diagnose the patient who has herpes. As for treatments, like I said before, there really is no cure for herpes because it is a chronic disease. However, there are medications and drugs that can be prescribed to the ones who are to really lessen the symptoms and ease the pain, such as Famvir, Zoravax, and Valtrex. Another treatment or remedy that will help with the pain of blisters would be warm baths to really just soothe the air infection. Some other potential and actually more severe effects of herpes include severe disease in immunocompromised people, as well as encephalitis or keratitis as a result of the infection leading up to the brain. Like I said, it can travel or be infected in other areas besides just the mouth, as well as the genitals. It can also lead to neonatal herpes, which basically means that if a pregnant woman has herpes during her pregnancy, it can also um, be given to the child, but it is also very rare. And there's also that generally people who have HIV also have HSV too, or vice versa. Okay, so I feel like I'm sort of jumping around, but anyways, we're going to the story of herpes now. So, the origin of herpes is actually unknown, but there are some early accounts of herpes that dates back actually all the way to the Greek writings. I'm not really sure how to say his name, but the guy in the picture, Hippocrates or Hippocrates, he actually wrote about herpes, and herpes actually means to creep, which is attributed to the way lesions move across an area, showing an outbreak. So basically, it'll start from maybe like part of your genitals and then it just moves and spreads. Hence the words to creep. So like to creep up, yeah. And actually in the ancient Greek Emperor Tiberius outlawed kissing in public to control the outbreak. So like I said, they weren't really sure what was really the cause, but they just sort of saw the pattern of, infection and kissing and spreading. You know what I'm saying? So today it is found that about 67% of the world population has HSV2, with the estimated prevalence that was highest in Africa being 87% and lowest in the Americas being 40 to 50%, which, I mean, to me, that's still pretty high. They also found that about 11% of the world population has HSV2, with an estimated prevalence that was highest in Africa being 31.5%, and then the Americas being 14.4%. They also found that HSV2 cases increase with age, which is pretty obvious because HSV2 is commonly spread through sexual activity. But however, they found that the highest numbers of newly infected cases were adolescents or teens. They found that herpes is endemic. They also found that more women are infected than men. They found that in the US, about 1 in every 6 people from 14 to 49 have genital herpes. And lastly, they found that more than 50 million adults in the US have genital herpes, and there are up to 776,000 new infections every year. Some even suggest that about by the year 2025, up to 40% of all men and 50% of all women will be infected or could be infected. Lastly, I want to talk about prevention. So, like I said before, there is no cure and no vaccine for herpes, so it is very important to protect yourself. In order to do so, you can take preventative measures such as avoiding contact and sharing objects that have contact with saliva with those who are infected with herpes. You should abstain from oral sex or sex in general, and you should be in a monogamous relationship with a partner who has been tested and has negative results for STDs. So that's pretty much it on my presentation. This is my bibliography, and I'll see you guys on Monday.